The aim of Test, Track and Trace is to hunt down and isolate the virus so it's unable to reproduce. And crucially, Test, Track and Trace allows us to take a more targeted approach to lockdown while still safely containing the disease. Creating this system is a huge national undertaking of unprecedented scale and complexity. We've already taken Britain's small but brilliant diagnostics industry and taken it to global scale. We're building an army of human contact tracers who can man the phones and find the contacts and support people. And of course, we're developing the contact tracing app, which can help us deliver Test, Track and Trace on the mass scale that we need across the country. The app, which takes full consideration of privacy and security, has already been tested in closed conditions at an RAF base, and today I can announce the next steps. From tomorrow, we will begin to pilot Test, Track and Trace on the Isle of Wight, starting with health professionals and rolling out this week to all citizens. I'm grateful to the huge enthusiasm shown by islanders who know that by participating in this pilot, they're at the forefront of helping get Britain back on her feet. So here's how it'll work. Last week we put in place the testing capability on the island. From tonight, the contact tracing capability will go live, and then tomorrow, NHS staff on the island will be able to download the app. And from Thursday, each one of the 80,000 households on the island will get a letter from the chief nurse with comprehensive information about the trial. Islanders will then be asked to install the app. Once you've installed the app, it'll start logging the distance between your phone and other phones with an app nearby. It's been designed with a form of Bluetooth that conserves power so the app won't drain your battery, and this log of proximity information will then be securely stored on your phone. If you become unwell with COVID symptoms, you inform the NHS via the app. Other app users who you've had significant contact with in the last few days will then be sent an alert by the NHS along with advice about what to do.
Now this slide shows new cases of coronavirus in the UK. From the 21st of March, you can see that obvious peak up to a high level in early April. And then you can see the pattern that has occurred in terms of new cases right up until the 4th of May. On this one, I have to say that new cases need to come down further. We have to continue to track this index and we have to get cases lower.